Distinguished guests, ladies and gentlemen, dearest friends, I'm indeed very happy to join you here today to address the event organized by the Al Madina Hereditary Blood Disorders Charity Society on behalf of Thalassemia International Federation, marking the International Thalassemia Day 2023 under the theme Be Aware, Share, Care, Strengthening Education to Bridge the Thalassemia Care Gap. The Thalassemia International Federation, TIF, is appreciative of the exemplary efforts that the Al Madina Hereditary Blood Disorders Charity Society, a valued member of our federation, and Professor Ahmad Tarawa personally have made for the realization of this celebration, which includes numerous activities such as community-directed awareness, educational workshops for patients and parents, and psychosocial support and rehabilitation discussions. It gives us indeed great pleasure, ladies and gentlemen, that with today's event, you not only unite yourselves with the broad global thalassemia family that participated enthusiastically in the celebrations of this very special occasion on and around May the 8th, all across the world, but also because we see that your activities reflect both the spirit and purpose of the day, which are to sensitize every relevant stakeholder to the realities of thalassemia and the needs of our affected patients, to share knowledge and promote thalassemia awareness amongst patients and the community at large, to improve existing policies and develop new disease-specific ones that will indeed facilitate patient access to quality health, social and other care, and to ensure that decision makers and competent authorities do recognize the great value of effectively controlling this disorder, which, if left unaddressed or suboptimally controlled, will inevitably lead to significant medical, public health, social, and economic repercussions. But very importantly, even most importantly, to the poor quality of life and social exclusion of our patients, leading also to premature death. TIF is also very well aware of the society's laudable efforts concentrated in providing medical, financial, social, and psychological care to patients with thalassemia and other hereditary blood disorders and their families as well. And its consistent educational and advocacy work towards educating the Saudi society about this disease with the aim of alleviating its considerable burden, the pain, the uncertainty for both patients and the society as a whole. Despite thalassemia constituting a serious healthcare challenge in Saudi Arabia, as in the rest of the region, with the prevalence of beta thalassemia considered one of the highest compared to surrounding countries and regions of the world in the Middle East, the country has indeed succeeded, and we are very proud as TIF, in developing and offering patients good quality of thalassemia services, and has made substantial efforts in the past decades to control the disease's prevalence through compulsory premarital screening, for example, and other disease-specific policies and programs. Tangible success and achievements can indeed be witnessed today in most areas of this country. Nevertheless, there is always room for further improvements, especially in the areas of disease-specific awareness, patient education, and more effective thalassemia prevention and control. Saudi Arabia is a country very close to the work of TIF, a country that TIF admires for its scientific research, its highly skilled medical and healthcare workforce, as well as for its efforts in bringing about huge healthcare reforms, including free universal health coverage and digital health infrastructures. Our federation has managed to establish long-standing collaborations and strong relations with government officials in this country, healthcare professionals, thalassemia centers, patient associations, and patients in the country throughout the years. We are indeed privileged to have fostered close collaborations not only with Al Madinah Hereditary Blood Disorders Charity Society Association, that has a strong patient voice, established national presence with educational and advocacy activities, and continued communication and participation in TIF's activities, but also with other patient-oriented institutions and associations throughout the country, across the country, such as the Al-Aqsa Association Charity for Genetic Diseases and the Saudi Friends Charity of Thalassemia and Sickle Cell Anemia Society, both representing patients with beta thalassemia. But also they do a lot of work for patients with sickle cell disease as well. Today, we remain deeply committed to continuing and expanding our relations and work in this country. And we are confident that in unity, we can achieve even greater progress for the benefit of our patients' health and well-being. Dear friends, distinguished guests, across the world, sadly, more than 70% of patients with this disorder are deprived of their basic human rights for decent health and social care. People with these disorders are still largely lacking safe and adequate blood, for example, safe, effective, and continuous supply of key medicines, chelation drugs, multidisciplinary care and psychosocial support, elements that are indeed essential, and they constitute cornerstone in the management and in addressing effectively this complex genetic disorder. So let us continue working together towards taking our patients out of misery, pain, disappointment, poor health, poor quality of life, and social exclusion that is happening sadly around the world. I am certain that you all agree that people in such conditions have their basic human rights largely violated. Saudi Arabia is a country that has both the humanitarian approach and the genuine interest for its people's well-being, and there is ample evidence to support that this has been achieved indeed in this country, while efforts are still ongoing for further improvements, as innovation, ladies and gentlemen, lies now before us. So thank you on behalf of Thalassemia International Federation for giving us the opportunity to be part of this very important initiative of the Al Madinah Hereditary Blood Disorders Charity Society. And congratulations indeed on this great occasion for which TIF would like to firmly state its undivided support. I wish you every success in your deliberations at this important event. And once again, I thank you dearly.